Congratulations on getting braces. I'm going to show you how to take care of them. And as a dental hygienist and a person sporting braces, I have a lot of experience with this. The reason you want to properly clean your braces and your mouth is so that you don't get gum problems like gingivitis while you're in braces, and so you don't get any surprises when your braces come off and have cavities in between your teeth or around your brackets. So the first thing, of course, is brushing. And that will get the bulk of the plaque and the food out of your mouth. I'm going to show you with a manual toothbrush, but you can also use an electric toothbrush. Doesn't matter what you use as long as you do a good job. I do prefer having a brush that has a smaller head because it's easier to manipulate. So if you're using an electric brush, you do the same technique, but instead of going back and forth like this, you just let the brush do the work. And the biggest difference between brushing your teeth without braces and brushing your teeth with metal braces is that you're gonna have to brush above and below the wire. Each tooth has a metal bracket, and then the wire connects all the teeth. So when you're brushing, it's gonna look kind of like this. You start above, and you go around your gums. In reality, you'd be going much slower than I am right now. And then you go back to those same teeth, except this time you're going underneath the wire. Okay, same thing with the lower teeth. I like to start underneath the wire. And go back above the wire. Lastly, you would brush the other surfaces like you do when you don't have braces. Brush the biting surfaces here, 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 and here. And then also the inside, the tongue surfaces, which would be here and here. So brushing will take approximately 3 minutes. If you're doing it in a minute and a half, you're not doing a good job. Okay, so brushing. Like I said, if you're doing this with an electric toothbrush, the only difference in the technique is that you're just holding the brush in place. So. And flipping to the top would look like this. Above the wires. Okay, the next step, and what I would say is the most important step, is using a water flosser to clean around the brackets, in between your teeth, and under your gums. So water flossing is a category of cleaners, but you've probably heard of a water pick. I have multiple types of water flossers, but my favorite one is the Water Pick Ion for multiple reasons. One is because it holds a lot of water, so I can do my entire mouth on one filling. Also, I can choose the brush tip to it. So this is the classic tip, and you can certainly just use this. But most water picks will give you a variety to choose from. This is the orthodontic tip, and it has some stiff bristles, and then the water will shoot out of the center. So as I'm going around, this would be on, it would be shooting water onto my gums, and then the excess water just falls out of your mouth. So it takes some practice to get used to using a water flosser, but you fill it up, you put it in your mouth before you turn it on, and then you lean over your sink. And imagine that there's water spraying out of this as I just follow around my gum line. You'll also do the gum lines on the inside or the tongue side surfaces. And I find that water flossing with braces is a little easier because you have each of the brackets, so you just follow along the margins of the tooth, stopping between the brackets. So you have good little stop points. So I would do the gum lines of my entire mouth and likely be done with my whole reservoir of water by that time. So we got brushing, we have water flossing, the easier of the flossing options, and we have brushing underneath the wires. So you use a specialty tool for this, but you can find it at any drugstore, H-E-B, everywhere has these. It's called a Proxa brush or an interdental brush, and what it looks like is a handle of some sort, whether it's a short handle or a long handle, and then at the end you have what looks like a bottle brush or a Christmas tree. I really like the long handle one, and I try to send my patients home with one of these to get them started because it's long, so you can get the back of your mouth really easily. And where this is cleaning is underneath the wire, the area that's too small for your actual toothbrush to get in. So that would be here. And the size that works best for my braces is the larger size, which has this as the diameter, but they do make other sizes. So after a couple weeks to a month, this will be worn out, and you just open it up, pull this part out, and then you put a new one in. So, super easy. Just slide it through, pop it into place, and we're good to go again. The brand that is going to be the easiest to find is the Gum brand, and it comes in sizes. As I said, you might want to start with the largest size, but also get medium and see what fits appropriately in between the wires. So once again, gone like that, all the way around. Don't forget your back teeth. Now, if you want to get extra brownie points from your dental hygienist, you're going to use string floss. This is the most time consuming and the least fun. So I'll be honest, I do not do this every day, but I wish I was patient enough to do this every day. So get one piece of regular floss, whatever floss you like. This is my preferred floss. And then you get a floss threader. There's lots of different floss threaders. This one's the best. And it's called Bridge Aid. So it doesn't have the word braces or orthodontics on here, but it's the best one. The reason why is because this is stiff and it's curve shaped, so you can actually get underneath a lot easier than other tools, which I'll show you. So we have this guy, this floss threader. You go ahead and get your floss and you put it on like that. And then you would go underneath. You just go all the way around. The harder areas are going to be your back teeth, so it'll help to have a mirror. So you'll find in between your back teeth. And don't forget when you're flossing that the back of the last tooth is a surface. So here, doesn't require threading, but you still gotta clean it. Okay, so I would say it takes a solid 3 to 4 minutes to floss thread your entire mouth. The other alternative to the floss threader being separate from floss is this guy. This is a single piece of super floss, and what super floss is it is one piece of floss that has a thicker area here, and this area is stiff, so it has a built-in threader capability, but it's terrible. The reason why is because this area that's kind of soft and spongy, it just gets ripped and stuck around the bracket. So that is very annoying. Also, because the stiff edge is not super angled, getting the back teeth is extremely hard. So, you know, I can't even do it without looking in a mirror. So what I end up seeing is that a lot of orthodontists will give their patients super floss to be their flossing option. And so they get this, they don't use it. They don't know about water flossing. They don't know that there is other floss threading options that work a lot better. And having tried a lot of different things, I have an idea of what is most effective and what is worth spending your money and your time doing. Another kind of cool product is called the Platypus orthodontic flossers. And the reason they're called platypus flossers is because they look like a regular floss pick, but this side of it is flat, like a platypus tail. So when you are going around these brackets, you just take the flat end and you go underneath. You probably work better on top. And so because this is so much thinner on this side, you can put it underneath. The problem is that when my teeth started to shift, there wasn't enough space in between the brackets down here to actually use this anymore. So it no longer fits there. So I used these at the beginning, but then overall just stopped using them. Now, my favorite product that I did not know about until I started experimenting was these little guys. They're called the Doctor's Brush Picks, and I'm sure there's other brands similar to this, but it's essentially a toothpick, plastic toothpick, that has these little kind of fin-like bristles here. And I don't know if you can see that, but they're really great at grabbing things. Like say you eat arugula or pineapple or something that tends to get stuck and has a lot of pieces, and you're out and about, you can just grab one of these from your purse and just really casually dig all the food out of your braces. So what I really liked to do is had this little pocket toothpick holder with a little mirror, and I just loaded it up with these, and it was a really good alternative for when you're out and about, when you're with friends, when you're at a nice restaurant, and you just know that you have tons of food in your braces because that's what happens. So love these guys. Lastly, something that doesn't involve cleaning but you're going to want to know about is wax. You ask me, why would I need wax with braces? Well, this metal is not kind to the inside of your mouth when you start, so it'll kind of rip up the inside of your mouth. You'll get a lot of kind of cuts and abrasions. Eventually, the tissue inside your mouth is going to keratinize, it's going to callus, and you won't have that problem anymore. But in the beginning, it'll be nice to have something that buffers the metal against the soft tissue inside your mouth. The mistake a lot of people make with orthodontic wax is they put too much on. So less is better in this case. So the first thing you want to do is, you find the bracket that's causing the pain or discomfort. So this one is a typical one for me on the edge here. And you get a very small piece of wax. Roll into a ball. So, that's maybe the size of smaller than a lentil. No, it's very small. And then you dry off the metal. So make sure there's as little saliva on it as possible so you can get a good stick. Put that right on the bracket. And then smush it into place. It doesn't look great, but it feels so much better. So always have wax on you. And that kind of wraps up how to take care of your braces. I think that it's something that I wouldn't have known unless I had experienced it myself, and I'm happy to share this information with my patients and other people, especially adults who having braces is a very different experience for them, and having food in your braces and being out in a professional setting can be really embarrassing. So having some of these tools at home, in the office, in your purse will help you keep your braces clean, your teeth healthy, and your gums healthy as well. Thank you.